North Central Behavioral Health is expanding its services and its footprint. In 2023, they bought the Hygienic Institute building in LaSalle. On Tuesday, they're going to be hosting an open house and cutting the ribbon on the new space. It's going to be happening from 4:30 to 6:30 on Tuesday. You'll see that the entire enterprise is now made up of 30,000 square feet on 7 acres. We're celebrating that because ever since COVID, NCBH has seen a 33% increase in demand for services. If anything positive came out of the COVID period, it's that we're more aware of behavioral health than we were before. And there's not as much stigma associated with needing help. In fact, I believe we should maintain mental health the way we maintain physical health, or at least regard it as important. It's getting there. North Central Behavioral Health is on the ground in 10 locations across 8 counties, and across those locations, the agency had 10,000 points of contact with people last year alone. You or someone you care about can find them more easily than ever now. Thanks to Kathleen Whalen of Whalen Financial in LaSalle for helping us get the word out about this kind of positive resource and their big ribbon cutting that's coming up on Tuesday. In fact, I was treated to a little walkthrough of the new building this past week, and I'd like to share it with you now.
We are in the new hygienic building, the North Central's Behavioral Health Urgent Care Clinic. It's our walk-in clinic that we just opened in September. They check in with our engagement specialists. Those are individuals with lived experience of mental health or substance, and they've also had additional training, and so those are individuals that can help be that piece of hope for individuals on the journey to recovery. And then they would step in to see a crisis intervention specialist, and they're going to talk to the individual. They're going to look and see what brings them in for the day, because we each have our own different crises. So it could be that somebody's depression has increased. Maybe they're having more anxiety. Maybe they've lost a significant person in their life, or maybe they've had other losses. They've lost a job, relational difficulties. Those can all be crises for individuals. So we will do an assessment to determine risk level, and also then determine what type of treatment that we can give them. If we can stabilize them, which part of the urgent care is we're trying to avoid hospitalizations, because we know that individuals that are linked to services, they're less apt to go into a crisis. And so that's what our whole goal here is to reduce hospitalizations and reduce trips to the ER. We actually cover 8 counties. We have offices in Fulton and McDonough counties, Bureau, LaSalle, Ottawa. We've opened an office in Morris in Grundy County. We cover crisis in 7 counties. We also have offices down in Lakin. So we have a large array of services, mental health and substance use services. So this is just an additional service that we're adding. Besides the urgent care here, we also are starting our mental health intensive outpatient programs for adults. So an individual has to be 18 years or older to participate in those groups. They will be 3 days a week, 3 hours, and we will focus on a topic. We will give them some education during that time, and then they'll also build a skill to that. So individuals that are coming through our doors, that might be a perfect fit for them to go into those groups for a short term, as opposed to just traditional outpatient services, or for individuals that are stepping out of a hospitalization. We may get referrals, they may be the individual themselves. We may also get a crisis call, but to actually come through our doors here, chances are it's probably the individual and their family themselves that have determined that they need help. And it's really okay to reach out and ask for help. And I know that for people it can be sometimes a scary thing with some of the stigma, but I feel like we are more open to it. And this can be the first step for people to work with some of our compassionate, qualified mental health professionals here. So this would be one of our offices of our crisis intervention specialists. They would be able to de-escalate them. They're that compassionate side that's giving them that piece to be able to share their story, and that way we can determine what treatment level we need to work with the individual on. We're here for our clients and the community to come right on in and be able to talk to somebody. And you know, there are other resources. There's 988, and there's also the Warm Line, Illinois Warm Line, that people can call. But it is to be able to talk to somebody face to face. That's
very comforting.
Yes.
When you need it most.
Yes. And also on site, we do have a therapist who will be running those intensive outpatient program mental health groups. In this space, we have about 6 to 8 of us.
Okay.
But I believe with North Central currently, we have 114 employees, and I know with the addition of these programs, we would be closer to 140 by the time we are able to staff all of these new positions. I was the crisis manager for 3 years for North Central until I stepped into this role, and I have seen an increase in the number of crisis calls. So part of also here, besides reducing hospitalizations, if we can get people linked to services quicker and more seamless, we're hoping that helps.
I imagine it's harder this time of year for a lot of people. Do you see an uptick in people
needing
help this time of year?
It can be right before the holidays and probably even after.
A little bit after.
You know, there's a lot.
Some people maybe miss family that they were just
family
with.
dynamic, right. Maybe there's a loss of a loved one. Maybe there are difficult family dynamics. Or maybe we are just an individual that's a single individual. So, or maybe our children live across the country. So there are those pieces. Plus, we're in a time of year where it's colder out, and I know for me, I leave work now and it's dark out when I go to my car. So for some people, that does affect them as well.
North Central Behavioral Health will never turn down anyone who comes to them for help. Their billing and paperwork systems are geared toward people with Medicaid, but they'll talk to you regardless. Once again, the ribbon cutting and open house for North Central Behavioral Health's expansion will be 4:30 to 6:30 on Tuesday in what used to be the Hygienic Institute building next door. It's just to the north of the current North Central Behavioral Health building. Thanks to all the people at North Central Behavioral Health and to all our healthcare workers who continue to help others walk out of the dark. And thanks to Kathleen Whalen of Whalen Financial for making it possible to share this lifeline with you, especially as we get into the holiday season. I'll talk to you in the morning.